This portion of New Day Northwest is sponsored by Humana.
Welcome back to New Day. According to the CDC, 1 in 3 Americans between the ages of 65 and 74 has hearing loss. Hearing problems can have a big impact on the quality of life, including the ability to live independently. Here to talk about the importance of getting your hearing tested and how Medicare can help with hearing aids is Dr. Carol Heyman from Iora Primary Care and Catherine Field from Humana. Welcome back to you. Thank you. Now, I mean, all of us need to hear well, but hearing for older adults really can be a make or break in terms of where you live, how you live. Tell us why it's so important.
Yeah, well, first of all, just want to underline that hearing loss in older adults is really common, and the reason for that is decades of noise exposure. We live in a
I'm
noisy,
in huge trouble then with my music.
Yeah, right. Rock and roll.
Right.
People who have occupational exposure to a lot of noise, people who turn their headphones up, all of those things can lead over time to damage to the hearing cells.
The only silver lining is you can pretend not to hear things you don't want to hear.
And people love to do that. They call it selective hearing, right? That's
exactly.
a little bit different.
But it's a serious thing, and it can be dangerous if you're trying to drive or any number of things.
Yeah, and in fact, I would sort of characterize the importance of hearing loss in a couple of categories. One is connection to other humans. So people who have hearing loss are able to participate less in conversation. They may avoid social situations where they're worried their hearing's going to be exposed. They may not hear their muttering grandchildren who speak out of the corner of their mouth. And then the other big category, I would say, is it turns out hearing loss is bad for the brain. So people who have untreated hearing loss have higher rates of depression, higher rates of anxiety, and even higher rates of dementia and cognitive impairment.
And we really want to encourage people, go and have that hearing exam. We can help you with this.
Yeah, so I really encourage
go.
older adults to get their hearing checked, and if something's found, to do something about it.
And if somebody says in your family, I think you're having trouble hearing me, go get it checked out. So Catherine, Dr. Heyman mentioned, you know, exams being important. Tell us how Medicare can really help with this.
Yeah, that's a great question, and it's always confusing on what does Medicare pay for and not. Medicare pays for what are called diagnostic exams, hearing exams, which means that your physician would need to refer you to a doctor for a particular issue related to your hearing. If you just want a hearing test, if your spouse says, go get your hearing tested, that kind of annual routine hearing exam is not covered by original Medicare.
Okay, but you can get referred.
You can get referred. Plans like the Medicare Advantage plans, that this is an open enrollment period of time of year right now, many of them do cover more broader services like a routine exam or hearing aids, etc.
Right. It's one of the many reasons why the Advantage plans can be really good for you. So if you go to a hearing exam and you find out you have hearing loss, will a Medicare Advantage plan pay for hearing aids?
Well, that's another great question, because cost is really one of the barriers to folks actually doing something about hearing loss. And so original Medicare does not cover hearing aids, but Medicare Advantage plans often do. In fact, in this area, more and more plans, Medicare Advantage plans, are offering some kind of a hearing benefit. This year, we partner with an organization called True Hearing, which covers both 3 visits to a hearing professional, along with state-of-the-art hearing aids and batteries and fittings, so that folks can get out there and get some really good coverage for hearing aids. When you talk to, the surveys have looked at like the cost of hearing aids. They tend to run sort of 2 ears state-of-the-art is about $5,000.
Wow.
In our plan, it's down to less than $1,000 per ear.
So it'd be well
really worth
it.
it. Folks who are concerned about hearing and interested in some really, and they're really good hearing aids out in the market today.
Let's talk about that, because the technology has improved. Hearing aids can handle a lot of different problems, and they are not, you know, huge and bulky anymore.
That's completely true. In fact, I think it's first of all worth acknowledging the elephant in the room. Nobody wants a hearing aid, right? But they have gotten really quite a lot better, and these are not your grandfather's hearing aids. Just like your phone and your self-driving car and your Bluetooth speaker, like the technology's really improved. So they're smaller, they're lighter, their digital sound quality is quite a bit better. In fact, I'll sometimes in the office go to examine someone with my otoscope and say, oh, a hearing aid, you know, so.
Because it can truly be, depending
really
on
quite
what kind,
invisible.
just really hidden. And nobody wants to miss out. So
That's right.
go
so
and do
I think
it.
it's worth it. And
I definitely, I wouldn't even care what size. I just want to be included in the conversation. So individuals with Medicare, let's say you have original Medicare at this point, now we're in open enrollment, so we can explore Medicare Advantage. If they want to talk to Humana, what are the different ways you can keep people informed about their options?
Sure, and there's really good options out there. I always encourage people to go to Medicare's website because they will help walk you through all the nuances of original Medicare versus Medicare Advantage plans, and there you can compare all the plans in the market. You can also go to Humana's website, and if you go to Humana's website, you can sign up to talk to an agent who will come out to your house or meet in a coffee shop and walk you through all the plans and all the nuances of how these plans compare to original Medicare.
Great. You can get that individual attention if you need it. Now, is it on Medicare's website or yours where you can like plop in all the things you think you need and it'll spit out your choices?
Both websites offer that kind of benefit. If you go to Medicare's website, it'll bring up the Humana plan and then the other plans that are in the market as well. You go to the Humana website, you're going to get all the Humana choices. So either one will start giving you some direction. The most important thing that you need to kind of think about is, what did I spend on care last year? What do I think I want to spend on next year? Do I want to look at something that has hearing aids as a benefit? Are my physicians and hospitals all in network for that plan? And then all the extras that come along with Medicare. So there's a lot to kind of compare and contrast. And you only have so much time. So
but at least if we start now, you can honestly customize this to what you need. And it's important not only for the person who's getting this insurance, but if a family member is helping you, these are great places to go.
Absolutely.
Thank you both very much. Appreciate it. To get in contact with Humana or Iora Primary Care, please visit humana.com/Medicare. We'll link all that information on New Day's homepage in case you didn't get a chance to jot it down. Up next, some important safety reminders to consider before you do online holiday shopping. This is very important. Back after this.